we're starting to make a habit of being a little late, but there's so many things going on in the building. I had 3 different lunches to hit, so I'm a little out of breath trying to get here. So welcome to Children and Seniors. The first presentation that we have scheduled today is Kdhe Acting Secretary Janet Stanek. Am I right saying Acting Secretary?
I'm still acting, yeah.
Yeah. Well, welcome.
Is it on now, or is it on now? Do you mind? I will remove this since I'm distance, if that's okay. Yes, Janet Stanek. I have met some of you. Unfortunately, I need my glasses to read a little bit. But yes, I've been 10 weeks on the job and waiting for confirmation hearing, but life goes on while that's all going on. We're very busy, and I'm happy to be here. I just want to tell you how honored I am to be here to present, and that I love the job, and that we have a lot of work to do, and it's all exciting to me. So I have with me today Kelly Mark, who's the Bureau Director for Family Health, and then Ashley Goss, the Director of Deputy Secretary for Public Health. You might know them because they've been here. So I just want to do a little presentation, and then if you have questions for me in my new role, that's fine too. But I want to make sure that we cover the points that are relevant to the committee, and also have them answer questions more specific to the daily work that they do. So you know that Kdhe, our vision is healthy living, safe and sustainable environments for Kansans, and then our mission is to improve the health and environment of all Kansans. We have 3 separate divisions, just to remind you, in Kdhe. Environment is huge, Medicaid is huge, and then public health goes without saying. Most people want to put the public health piece first, but there's all of it intersects. And so just a reminder that we have many activities going on in the agency. You will see on slide 4 kind of how we're structured, and at the center of that is kind of a challenge and a priority, which is recruitment and retention of employees. Nothing you're probably not hearing from any other agency, probably no other employer in the whole state or the whole country right about now, but it's very important, and one of my focuses has been to focus on that infrastructure and our human capital and resource needs in the agency, because if we don't have that, we can't run a good agency. So lots of work going on there. So the programs for children and seniors that focus maybe that you're more interested in for purposes of today's discussion are CanCare, which is Medicaid, child care licensing, and then women and children. The WIC program, you know that. You know that CanCare is the managed care program for Medicaid recipients, and 95% of Kansas Medicaid members are enrolled in that program. CanCare launched in 2013. The goal was delivering whole person integrated care to about 415,000 people across the state, and due to special federal and pandemic rules and issues, we currently cover even more, about 500,000 people. We have 3 contracted health plans that are managed care organizations: the Aetna Better Care of Kansas, the Sunflower Health Care Plan, and then United Health Care Plan. So these contracts are competitively bid, and every CanCare member has choice, and they're allowed to pick from a different MCO or managed care organization. We also partner with Kansas Department of Aging and Disability, KDADS, because we administer most of the program, but they also administer part of it as well. And so we maintain at Kdhe the financial management and contract oversight. By KDADS has the Medicaid programs for the disability services, mental health services, and substance abuse services. With the Child Care Licensing Agency, big part of our life at Kdhe, we basically provide basic level of protection and safety. That's our goal to children, and assure that there's standards in place, that health and safety being a priority in the homes or daycare settings that our children are in are safe and operating effectively across the state. This Child Care Act began in 1919. We licensed daycare homes, group daycare homes, child centers, preschool, school-age children, and drop-in programs. So currently, we license about 4,500 programs, about 134,000 plus children total capacity. Unfortunately, and you may know this just from living in the state and with what's gone on, we've lost about 40, let's see, in the last 5 years, we've lost providers, particularly in the group day care home setting. A lot of the loss is not due to regulation, although that tends to come up, that the regulations are too stringent. It's really due to aging workforce, retirement, unfortunately low wages, no benefits, no health insurance coverage, long hours, and low appreciation for the field. The licensing is only one aspect of the broader child care network and programs that we have in Kansas. The child care aspect of KDHE is mostly funded through DCF with child care development funds. They cover the health and safety aspect of the Kansas Child Health Care Plan. We work with partners and systems and try to, leverage each other related to impact grants for current providers, startup grants for new providers. We have explored and are exploring retention bonuses for existing providers, workforce registry, a formal career pathway, and we are trying to tackle the wage issue because we resoundingly hear that that is the main issue that providers say over and over: low wages, no benefits, leads to no staffing, and therefore no impetus to have a daycare or want to run one. So during COVID, our unfortunate crisis over the last 2 years, about 20 facilities fully closed. And right now, due to COVID, we have a lot of temporary closures. They have either rooms closed or they've closed totally because of the same reason a lot of businesses have closed. They don't have any staff. And right now, the newest COVID guidance for child care providers was released January 31st of this year. And we have that posted for people to review and see what those guidelines are on our KDHE webpage. The Women, Infants, Children Program, WIC, is a very important and needed nutrition program that provides nutrition and health education, healthy food, and other services to Kansas families who qualify. WIC is a national program, and a lot of people, again, rely on that. Nearly half of the babies born in Kansas participate in WIC. About 9,000 women, 9,900 infants, and total children between 1 and 5, about 23,000. So you can see how much it's needed. So opportunities for improvement right now with agency legislative initiatives for 2022, you may want to be aware of or are aware of is, basically support for public health practices. Public health, how will it be redefined post-COVID is a big question, and that flows to all areas of our agency. So we will be looking and working with our stakeholders on that. Appreciate any support and funding for existing programs, budget enhancements for public health, and in particular this year, maternal and child health home visits, and budget enhancements for Medicaid. And you probably have heard extending those benefits for mothers from 60 days postpartum to 1 year. And there's a lot of, I was at Pediatric Advocacy Day yesterday and heard from a lot of pediatricians on the benefit that will provide because postpartum depression and other things occur way past 60 days. And so lots of good supporting evidence to support that. So we hope you'll support that as well. Basically, public health items in the governor's budget for that expansion, there's about $1.4 million in fiscal year 23. Universal home visiting, it strengthens the home-based program as well. It's a safety net for families across Kansas. There are no eligibility requirements, and the goal for every pregnant woman is at least one visit during that 12-month period. There's also education that goes on during those visits to help women know what resources are available to them, but just give them the emotional support they need as a new mom. And there's a lot of rituals on, warning signs of some, maybe the depression, but other issues related to mental health, breastfeeding, safe sleep for their children, and things like that. So it's a really great thing. There was a $1 million included in the SGF for the and 4.2 and FGF 23 to expand coverage for those postpartum moms that I talked about. The ARPA dollars that we've received allow state to extend coverage through a state plan amendment. If implemented, the coverage would begin April 1st of this year. Currently, about 2/3 of those women lose coverage from Medicaid too. Another reason to expand it after that 60 days is not only that they won't get the visit, they lose their total coverage, and then they have a lack of access for both physical and mental resources, not just for themselves, but for their children as well. It also would let new mothers who are already eligible keep their coverage during and through the baby's first birthday. The Kansas Maternal Mortality Report found that nearly half of all pregnancy-related associated deaths occur 42 days postpartum. Medicaid moms, per our data, are at most risk. So there are a lot of good things. I think, again, thank you for the work that this committee does to recognize the importance of women and children. And again, I have my coworkers here who are in the trenches daily that can help me answer any questions you may have on anything. I'll stop there, ma'am. So thanks very much.
Well, thank you. Oops. Thank you. Thanks for being here. Committee, do we have questions? Representative Helmer.
Yes, Secretary, I appreciate what you're doing. I really do. And I think there's a world of work out there to do. I was a counselor and a teacher before that, and there's a lot of education people here, so they probably share in my thoughts. I was in several high schools, and girls would get pregnant naturally. And when they got pregnant, they didn't get pregnant once. They got pregnant 2, 3, 4 times by the time if they stayed in high school. So my question, it always bothered me that they didn't get enough care and enough attention and enough education, and they didn't get enough in home with those babies. And I was a very active person, so I went to a lot of the activities, and so I'd see the babies dressed up really cute and being passed around as little tiny babies and in really cute outfits and basketball games and football games, and everybody would love them and everything. And then later on, and I ran into somebody a couple years ago, and she had given all of her babies up to foster care. And so that breaks my heart, and I think that happens to a lot of children. So there's a lot of work to be done. So how are you reaching, my question is, and that was a long explanation, but that was deep from my heart and experience. So how are you, or are you able to have something that reaches that age? And
the school.
Right, thank you.
I'm going to have Kelly or Ashley talk about that.
Thank you.
Thank you for the question. I will step aside.
Hi, Kelly Mark, Acting Bureau Director of the Bureau of Family Health. Thank you for your question. So we have 2 targeted programs just for teen mothers. One is the Pregnancy Maintenance Initiative, and the other one is Targeted Teenage Pregnancy Case Management. And what those programs do is they provide targeted case management services for adolescents that have become pregnant, really about finishing their education, spacing their pregnancies, knowing that they are empowered to choose when and if they get pregnant. So those are 2 that specifically work with teens. Home visiting, universal home visiting, also can target the teenage population because, as Janet said, it is a no eligibility program. So we work with hospitals, work with community organizations, trying to educate about the program and get everyone we can, especially our high priority populations, enrolled in those programs. Thank you.
Further questions? Representative Wagoner.
Thank you, Madam Chairman. Thank you, Madam Secretary, for being here today. I have a couple questions. I'm from Reno County, and there's been an awful lot of concern about the whole child care situation as far as, daycare operations. And I'm just wondering, there's concerns about the apparent, increase, at least in our area, of just regulation enforcement or just, like crossing every T and dotting every I. Is there anything that your department is aware of that has changed or that you would be interested in changing, seeing that it apparently is creating problems?
I'm going to have Ashley Goss, our Deputy Secretary, speak to a little bit of that. We have been focused on how we can streamline operations a little bit more. One example would be going from paper fingerprints to the electronic system. We're trying to work with law enforcement about that, for example. I think that the feedback that we've received is that we don't really feel that the process and the regulations have changed or that there's anything more, but we sometimes find that we don't get the information we need to start the ball rolling, and we do aggressive outreach to those providers that need help getting their application or their maybe deficiencies corrected. But Ashley, would you like to speak to that a little bit more?
Afternoon, committee. Ashley Goss, Deputy Secretary for Public Health. I don't have a lot more to add on from what Secretary Stanek has said, outside of the fact we're trying to look for ways to be more creative, working with our surveyors to be more, I don't want to say friendly. I like to say our surveyors are friendly, but nobody likes a survey, right? But they're necessary for the safety of our children. So more of an education piece. So if they're going in and they see something that's maybe out of place that by regulation it's supposed to be put away, maybe you need to put this away versus, cite you and move on down the road. So there's many things that we're looking at. I'm aware of Reno County and some of the issues. Full disclosure, I'm probably not aware of all of them as our program would be, but we're always looking for ways to get more providers into the system, to work with them so that parents have coverage.
And if I can still talk to you, because actually, if you specialize in this, one of the things that had came up locally was as far as, the Department of Labor, whoever does inspections for businesses, they actually have a program where they will, it's like, rather than having a literal like OSHA inspection, it's like a state of Kansas inspection where there are no citations. It's just basically, here's what you need to do to get things done versus sort of the business person's, worst nightmare of having, OSHA randomly show up and they're just writing anything that is odd off. Have you guys ever thought of having sort of like a, where people can say, can you please have someone come by and tell us what we're doing wrong and it's not going to be citations? I mean, has that ever been a thought?
Absolutely. And so our program is set up as such. So in your example, if you have a provider, let's just say a new provider, and they want to make sure that they're going to pass everything, it's set up so that we're a resource. Yes, we're the regulatory agency as well, but we also are the resource because we want you to succeed because we know that childcare is needed in the community. So we do try and work that way. I know previously we've had surveyors who are no longer with us who maybe didn't view it quite that way, and it was more of OSHA, the OSHA view, but the way our surveyors are trained and led, it is more of, let me help you. Now, that being said, if a surveyor walks into a house and sees, we can't just like close our eyes and not note something, right? Especially when child safety is the issue. But we do try and provide the education. Our team is open to questions and being a helpful resource when someone is trying to become a provider or when they're trying to work through things. Like if they aren't really quite sure how to meet the requirement or how to fix something, they're meant to be a resource to help. It's not where we go in and say, oh, we find A, B, and C, we're leaving, we'll come back in 2 weeks and make sure A, B, and C are fixed. If we find them and you need help, we're there to help as well because we want them to be successful.
If I may, just part of the issue has been, daycare is stressful enough. It's a very low cost, low profit, if you can even make a profit at it, type business. Or if you're a nonprofit, just the, is the hassle worth the community service that you're providing? And just, people do get burned out kind of easily, if they feel overregulated. Is there, is there anything that you guys have internally as far as changes? I had heard somewhat as far as on capacity changes, as far as something of changing like the 18 months old to the 12 months old, or some variation in sort of the head count as far as what is allowed, per employee at a daycare. And I hope you can, I think you can track my question, or enough.
Yeah, I know exactly what you're talking about, and I'm honestly going to refer to Kelly Mark, our bureau director, but we are working that. We have a proposal put together. As you know, it's in regulation on how many kids can be in which age group. So we do have a proposal to increase the capacity and also to stay in line with what the fire marshal allows. But I can have Kelly come up and talk specifics if you would like.
Sure.
Okay.
Hi, Kelly Mark. Thank you for your question. So yes, as Ashley stated, it is in regulation, our capacity tables. The ones we're working on amending right now are for the group daycare homes and the licensed daycare homes to give them more flexibility. We're really finding the shortages are in infant and toddler care. So the changes we're trying to make is to increase the capacity of the number of infants that they can have while still in line with the number of providers that they have. We do want to change the infant definition to 0 to 12 months. It's currently 0 to 18 months for those home-based providers. Child care centers is 0 to 12 months, so we're aligning those so that they're the same. That will allow providers greater flexibility in the toddler category, which will then be 12 months to 5 years. They can substitute school-age children for any of those numbers. But if we get these changes through regulation, they'll be allowed 4 infants, decrease maximum capacity of 6, because we still need to allow them to be able to get all of their children safely out of the home if there's a fire or a tornado. And having 4 infants that aren't walking is quite a burden on a provider to get to safety. So we're decreasing that maximum capacity while giving them the flexibility to have more infants.
One more question. I've understood that there's a lot of federal money, from the COVID or the CARE Act or something that was set for, child care agencies and groups and such. I mean, I've heard like tons of money, and is that really true? And then like the local people, it's like, how would they access that? Or is that, what's the story on some of this, CARES Act or whatever funds that are perhaps available for people?
Sure, thank you for that question. So the 3 big buckets where the CARES funds are being used for providers right now is background check fees, normally are $47 per individual that gets fingerprinted. ARPA funds are covering all of those fees for all providers right now. Licensing fees, generally providers have to pay to be licensed depending on what license type they have. All licensing fees are being covered by ARPA dollars right now. Then there's impact grants. We started with impact grants for current providers. $2.5 million went to grants for current providers. We've got $3 million that are going to startup grants. So when you mention those initial surveys, when our surveyors go out and do an initial survey and they say, you need a fence in place before we can grant you a license, those startup grants are available to those providers to get that fence put in place so that they can get their full license.
And I just be aware, I'll talk to you after the committee because we really have a lot of questions in our town. So.
You got it. Thank you.
Thank you. Kelly, I think I have a question for you too. I guess to follow up on the federal funding, I've also heard that the Build Back Better bill that's not passed on the federal level has funding in it for child care. Can you tell us what that is? Do you know?
If Build Back Better passes, it would really impact childcare in all of the states. So if it passes, we as a state have to agree to accept that. So the governor would say, yes, Kansas is going to participate in this program, and then we'd be able to draw down those federal funds. So it increases wages for providers. In all actuality, it tells us that we have to pay them a living wage, and it has to be along with what we pay teachers. So there's money in there for wages, there's money in there for increased quality, so we can increase our DCF does our links to quality program right now, so there's a lot of funds in there to increase quality programs for providers, and universal pre-K. So there's a lot of dollar in there for universal pre-K, so parents wouldn't get charged that. It's almost like a copay for health insurance on how parents would get charged for childcare as well as universal pre-K. So if they make a certain amount of money, they only have to pay a copay for childcare or pre-K. And in the universal pre-K, it has to be spread across all program types. So it wouldn't just be tied to schools. We'd also have our home providers that would be able to provide universal pre-K, and they would be able to tap into those funding dollars as well.
Okay, great. That's exactly what I need to know. Now I have a question for Ashley. Hi, Ashley. I haven't seen you in a while.
I know.
So I can't remember what year it was that we had the bill regarding child care enforcement. Would that be the right word? Do
Probably.
you remember that?
Kind of.
Yeah, that you have the ability to regulate, but there's no teeth in it, that you don't
Right.
take away licensure, you don't fine. Is that still the case? I mean, that bill didn't go anywhere, so.
So, and Kelly, I'll rely on her if I misspeak, so hopefully she throws something at me.
Well, maybe that question was for
So-
Kelly. It's just that we had worked together before. So.
Right. So now, we can, it depends on, I remember that bill. I don't remember all of the in the weeds things with that bill, and I'm sorry,
I don't
Representative,
remember either.
I can go back. But I can tell you, like, in general, yes, we can suspend a license. But KDHE can't just say, Representative Kincannon, your license is suspended. There's obviously a process and a hearing process and all the things, if we have findings that would indicate that needs to happen. Now, other agencies are involved, DCF is involved, oftentimes, depending on what's happening, law enforcement's involved. So these are pretty severe things. Now, illegal childcare, maybe, if we see that happening, there is no teeth in that. So maybe, I think that's probably what you're talking about. This actually, if I recall correctly, lies on the county attorney to enforce. Most county attorneys will not do it. They don't have the bandwidth because of their caseloads. So if I go to your house as a surveyor because I've been told you're allegedly watching kids, I walk in and it's very apparent you're running a daycare, I tell you, basically, you have to cease and desist watching kids, and you need to get licensed, here's what you need to do. You don't do that. We go back a couple weeks later to ensure you have stopped watching children, and you haven't. That's where we have no teeth. So we would make the county attorney aware of that. But again, like I said, the caseload in counties, they don't have the resources to do that. And if I remember now, that bill was to put that into KDHE, to let the KDHE staff handle that, because we could have the resources to do it. And honestly, it wasn't to prevent people from becoming a provider. We want you to do the right thing and become licensed, but it's to keep our kids safe in the long run. So we want to ensure that you have the ability to be able to provide care for kids, keep them in a safe environment. It didn't go anywhere. I remember there was a lot of back and forth about it, and so I recall now, yes.
The more you talk about it, the more I'm remembering it now too. So the ultimate issue with that was the number of kids in the home about like watching each other.
And or the neighbor for a few minutes. There's lots of little intricacies into what's allowed and what's not allowed. And it really wasn't targeted at them. There's an allowance for that to happen. It was targeted at the people who consistently have children in their home that are outside of the allowances, such as it's my sister's kids and I have to watch them for whatever, or my neighbor had things like that. Those people aren't targeted. It was the ones who consistently try and operate a daycare without becoming licensed is what that was for.
They don't go through the safety, they don't have the fire marshal
Right.
inspection, they don't do
Right.
CPR training and
And if I remember correctly, as we talk about this more, it's
going
coming
down
back.
memory lane here.
Right. If I remember correctly, that's where the hangup was, is people weren't 100% sure that we weren't going after you're watching your sister's kids this week, or my cousins are in town, or something like that. But I mean, I don't know why, but that we could never land in a good space with that, because we had documentation to show that's not who we're targeting, but then there was lots of what ifs or if this, and so, yes.
Yeah, we should be able to work out the details on that and figure that out. I don't know if this is the right time. I guess it's always the right time to do the right thing for the kids, but, politically, it's that childcare issue is kind of on fire, so not sure that it's the right time, but I think we should continue conversation about that.
Yes, we can certainly work with you on that. You know how to get a hold of us, or we can schedule an appointment with you and come discuss it again. Not a problem.
Great. Okay, other questions from the committee? Anything, doesn't have to be on childcare. Anything else? Okay, great. Thank you. Thanks for coming over. Oh, we do. Representative Penn. Right at in the nick of
Late. I
time.
do apologize for the lateness of the question. I just thought about it. Thank you, Madam Chair. Madam Secretary, I'm big about communication, right? Is there anything that this body can do to increase the flow? I know you said a little bit in your remarks before I came. Is there anything that we can do to increase not only the flow of communication between directors that have the same information that could help you in your work, but also, as Representative Wagner was getting at, the information flow and communication and ease of access to the information on where all of the different amenities and pots of money and different funds and programs and everything for the community, tying that in as well. Do you have any thoughts on that, how we can make that a better access point and a better interchange across government so that the kids are helped better?
I'll give you my high-level discussion or my talking point on that, and then I'm going to have Kelly talk about what's there now and then maybe what we have planned. I was asked by several to put together a top 10 list, and I would tell you that of what my priorities are. I don't have a big vision statement to present. I'm hit the ground running. I'm here to help, and right now it's not a really good time to recraft a vision when we're trying to find our way out of what we've been through the last 2 years. And saying all of that, communication is a huge focus of mine. You can ask them. I'm knee-deep in editing memos, letters, making decisions on where we post, who gets information first. For example, do the schools get something before the local health officers, and then are the schools coming to the health officers and then in the counties, and they don't know what we're doing. And it's been a very challenging to get a handle and reinforce with the team at Kdhe about the importance of how things flow. Probably easier for me because I'm coming from outside, so I see it different because I haven't been in knee deep. So to your point, I will commit to you that it's a big priority. One of the things I've been doing also in my role is reaching out to all kinds of different stakeholder groups. I've had feedback from some that say, you could have used us a lot more in the last 2 years to help you with the response, for example, to public health in the pandemic. So updating website, updating communication flow, making sure we have the right message to the right people, not a one-size-fits-all, here, let's just send this to 10 different people, and how are they going to interpret that and apply that to their most important, I guess, what their interest is or what their stake is in an initiative or a reg change or something. We are sending different messages and really working on tailoring. So thank you for that question because it's really critical because we want to be the trusted source, whether it's environment, public health, Medicaid, or childcare. I'm going to have Kelly or Ashley talk about what resources are there now in the communication efforts that have been done and how that information flows to the childcare agencies that we have throughout the state.
Thank you, Madam Chair. So I'm going to talk specifically about the early childhood system and how we're creating communication amongst that. A couple of years ago, the Children's Cabinet was a recipient of the Preschool Development Grant, and that's really been our systems building grant to collaborate collaborate across agencies as well as community organizations. So that grant allowed us to put a formal governance structure in place, which is really how communication flows from individuals' lived experience to our advisory panels, to the Children's Cabinet, and then ultimately to the governor's office. Also, there's the problem with you have all these websites out there, right? You've got DCF's website, Kdhe website, Help Me Grow, Links to Quality. So we're contracting with a university to bring all of that information into one site that's going to be called Navigate Early Childhood, Navigate EC, and that's going to be your one-stop shop for everything early childhood across Kansas. So it's going to have links to quality. It's going to have information about home visiting. It's going to have information about the Children's Cabinet. Really, you should be able to find everything you need to know, whether you're a parent or a provider, all on that one site. It is in development right now. Hope to be released very soon.
Okay, any other last-minute questions? Okay, thank you so much for being here and your whole crew, and yep, stay in touch. Okay, next we have the long-awaited State Long-Term Care Ombudsman, Camille Russell. I think we've had to reschedule her twice, but, you know,
Well,
welcome to committee, Camille.
Madam Chair, thank you for the opportunity, and we'll get over here when you ask us and when you have time for us, because it is important things. We appreciate all of your work with children and seniors. Actually, children work was something that I did in my early years, so I have a heart for that as well. Camille Russell, I am the State Long-Term Care Ombudsman, and I do appreciate your time and attention today to be able to come over and talk to you about what the Long-Term Care Ombudsman Program does. Historically, the Long-Term Care Ombudsman Program has been a model for person-centered practices. And so sometimes our work, when I say that, that means we are resident directed. The people that we serve have choice and control over their lives. Not only with us, they actually have that by regulation in nursing homes and other adult care facilities. But for our program, that has been the case since its inception. It was a demonstration project in the early 70s. By the late 70s, it was a full program, and it is now in every state through the Older Americans Act. There is an ombudsman, long-term care ombudsman program, and a state ombudsman in every state, and also in Puerto Rico, Guam, and DC. So what we do is we provide advocacy, education, and probably most importantly, empowerment. And what we really like to do is give residents, people who live in adult care facilities, the information they need to be, they're the best advocates for themselves. They know what they want. But a lot of times they don't know what their rights are. So that's probably one of the most important things we do is we let residents know of their rights. We let their family members know of their rights. We oftentimes spend time reminding the facilities of what the residents' rights are. And so those are the things we do the most. We do complaint handling. It's probably important for us to say when we say a complaint that is solved based on what the resident wants or does not want, and only with their consent. So we don't do the work of Kansas Department of Aging and Disability Services in a nursing home that does regulatory compliance. That is not our job. We don't do adult protective service type investigation. It's to a different level and for a different purpose. We don't obviously do for criminal standards in a legal case. Having said that, there's other situations that we might investigate. We have the authority to investigate, including abuse, neglect, and exploitation, but to resolve that towards what the resident wants. If something happens in your own private home, you kind of have a choice about whether that goes anywhere or not and what gets done with that yourself to some extent. And they are living in a home, and they have that with the Ombudsman program. They have that choice. There are other people in there that are mandated reporters and have an obligation at a different level, but ours is to the resident. And so that's important to know because sometimes people get upset with us about how we are or we are not operating. And so we are very true to the resident. We will honor them. I want you also to know that anyone that contacts our office, without their consent, even third party. So whether it be a legislator, or whether it be a family member or anyone, we cannot tell anyone else that you contacted us or what it is about without your consent. So we could provide you information and assistance. We'll talk to you about what those rights should have been. We'll talk to you about what the regulations are. We'll provide you information and assistance to make your next best step. But it may be that, say, a daughter could call us and say, I'm worried about my mom, but I don't want her to know that I called you. That means that when we go to visit mom, we just kind of have to do a general visit and how are you doing? And we're pretty good about leading to conversations to maybe see if those types of things were going on that daughter might be concerned about. But if daughter doesn't give us permission to tell mom, it's going to be real hard for us to get consent from the mom to call the daughter back. So those are kind of examples that sometimes people get frustrated with us, but we have to really honor the confidentiality of everyone that contacts us, and certainly the rights of the resident to choose then how things are handled. So our complaint handling or our investigations sometimes get confused. Now, if a resident does want us involved and to provide information to Kansas Department of Aging Disability Services or to APS or for a criminal case, we absolutely do that and work with them on that, and oftentimes can get additional information that doesn't come to light through the other entities. So that's important to know. Education and training, we do a great amount of education and training. And we do that, we do community education, we do it in the nursing homes themselves, we do it with residents, we do it with, we encourage the facilities to take advantage of some of the training that we have around abuse, neglect, and exploitation, around our residents' rights, with person-centered care. I'm going to get back to that a little bit more as we get to the end. Again, information assistance. We provide significant amounts of information assistance about a wide range of topics that are linked to residents and resident care. Systems advocacy, coming here today, and I'm probably going to say some things to you today that may feel uncomfortable. It's really important to understand that no change really comes without some discomfort or optimistic discontent is what we like to call it, that we sometimes recognize that something's not working. That's the first step, and well, what are we going to do about that? So we all want to work together for everyone to just have better lives. So our organization is so extremely small. We literally only have 7 regional ombudsmen that are out in the state of Kansas, covering 105 counties, and over almost 750 homes between the licensed federal homes and state homes, and charged with doing a significant amount of work. And actually, I'm just pretty proud they do a pretty good job considering the load that they have. We additionally have some assistance we have 36 volunteers right now that have been active. COVID really did impact our volunteer base. But some of them also chose, even while we were out, we were restricted from going in nursing homes for a time. When we were able to put our training, and we were given the green light to go, we put our training in place and we re-entered nursing homes. A significant number of our volunteers also accepted to doing the extra training required and have been entering those nursing homes as well. Some have chosen for different reasons to wait, and that is perfectly okay. We appreciate them as well, and we'll get them back in there as soon as conditions change. But you can see I think you were given a report, and so just kind of an idea, those 7 regional ombudsmen, 1,365 complaints that they worked on, and that would mean multiple contacts with multiple people as we work on those. We have a 73% resolution rate. And again, that resolution rate is based on what the resident says. We can think we've done the most wonderful job at everything we've thought we should be able to do. If they are not happy with that, we do not get to put down that is resolved or partially resolved. Conversely, we might have thought it would be nice to be able to do more. And if they are happy with what happened, because that is all they wanted to happen, they can say that is resolved to their satisfaction. Our facility visits this year were down considerably. Again, that would be pandemic related, not being able to be in the building to begin with. It made complaints much harder to work. We want to be in those buildings. almost 3,000 instances of where we provided information and assistance about a wide variance of issues. Could be guardianship issues, family interference issues, visitation issues, COVID issues, a lot of different information and assistance. And then one thing that we feel like has been increased in this last year, and cooperation with Kdhe, I'm just going to tell you, is that there is a in the state operations manual for federal nursing homes, they are required to give notice to the Ombudsman program when they are doing a survey. And they then use our feedback, which again, we sometimes can only do it without names or just types of complaints, nature of complaints, how many complaints, that type of thing. But we can give that information back to the survey team, and they input that as part of their pre-survey preparation as to what they would maybe be able to focus on in that very short time with very few people going in to look at a lot of different areas in a nursing home. 313 times that we were able to do this last year. I will say at this point, we're very happy at the cooperation and some increased communication with Kdhe in that regard. We still would like to see, and I tell them this directly, we would still like to see a greater focus on resident rights violations. If you notice in our report that 63%, well over half of our work is done, the residents, what they care about is their rights. They care about dignity and respect. I sometimes say, if you guys would just even look at dignity and respect issues, you could clean up a whole lot of other problems in the building. So we'll continue to have those conversations. But you can just see that a big one this last year was around visitation and visitation rights. We did have continued that even when visitation was open up, and even when really pretty good guidance was put out by CMS, by the state around that, we still had a lot of resistance from some organizations. Typically, it tended to be policy outside of that frontline organization that this would happen, that there was a significant still, and there we still read up with significant visitor restriction issues, where they're still not allowing people in the homes when they should be allowing people in the homes, and undue restrictions. During that, we were afraid that resident rights, when people were kept out and family members were kept out, we were afraid that resident rights would be, quashed more, and they were. They just were. It's the nature of things, and we were worried when things opened up that there would not be a good recognition. Well, there wasn't always a great recognition in some places, but that they would be, have been down further. And what we are seeing, we are entering homes, and it is somewhat frustrating that we're meeting up with a lot of individuals who do not know what resident rights are, who do not know what an ombudsman is, who have not had the training and education and support they need to be able to support that. And it is a legal and regulatory requirement that people have these resident rights. So that has been somewhat frustrating. And we do think that we have some work to do to build back on that. Staffing issues, we know, we've heard it, everybody has staffing issues. Although I am actually proud to say that not only are we fully staffed, we were not fully staffed when I got the job the first of last year, we are fully staffed in that little small number of people. And additionally, we have used some COVID monies to have a special ombudsman, project ombudsman, to help relieve some of the non-travel ombudsman work that can be done. It will be temporary one-time funding, so us being able to keep that position is, not something that we could have promised. We also used that one-time funding to hire a part-time training coordinator to do person-centered thinking training. I'll talk about that a little bit more later. The reason we can tie about everything besides resident rights and dignity and respect, and looking at that, we can tie that not happening to staffing issues. We talked about staff not having the information that they needed to be able to do their work. And residents have a right to be free from abuse, free from fear of abuse, neglect, and exploitation. And yet, during this pandemic, it has been far too prevalent. And I want to just say that typically our reports come from residents, and then family members are the biggest reporters. But we have had an increase, and even of late more, because of staffing shortages, I think probably, where we are getting contacted in our office through our website. We do accept complaints through a very rudimentary way on our website. And we're getting more of those are from staff. And I think it's important that we're supposed to bring the residents' voice to you. And the residents tell us they don't want to get the staff in trouble because there's hardly anyone there to take care of them. They don't want to make a complaint. They're worried about the staff too. And the staff are contacting us, and the residents are supporting these things that the staff are reporting. They're saying they do not have the backing of other experienced staff in that home. They express fear for themselves. They express fear for residents. The words that are on those reports are desperate, afraid, fed up with the treatment and lack of care about the residents. They're in a desperate place themselves sometimes, and they are expressing these reports of concern for the people they're caring for. When you're in a survival mode, sometimes that's hard to do, but they're doing it, and we appreciate that. We appreciate them and the people that are still there working and really trying hard. We have reports, more than one, of people being left in wheelchairs for an hour upon arrival from a hospital because the people on site don't know how to transfer them from a chair to a bed. That dressings are not changed for weeks, that they're showing up and they're finding individuals laying in bed with foods having been placed in their mouth, but they didn't have the ability to swallow. But these are staff that don't know them or don't know how to do these processes. Reports that residents could not feed themselves, had not received food at all, had sparse amounts, or cold and inedible. And I want to tell you, those are common things from residents and or their families, but these are ones I'm telling you are coming in from staff. And they don't know what to do. They feel like they've gone internally and there's no one there. They're not being supported. There's not people there to support them, and it's somewhat situational, right? But teeth are not being brushed, dentures not being cleaned for periods of time. Staff taking pictures, not realizing that it's staff taking pictures of residents, openly making fun of residents with dementia, posting embarrassing videos on social media. This is not in every home, but this is not just in a handful of homes, folks. And we need to know we do have those problems out there, and we need to pay attention when we're considering, this is an important profession, and we need to really pay attention if we are degrading or not supporting or making there be less training. We don't need less training, we need more training. Okay? And I have to say that. We have homes, I want to say, we see some people and homes, entire homes, do exceptional work. We see them do that without agency staffing that do not have high turnover. And I think we need to be asking them how they do that and do more of that instead of giving any breaks to folks who are not supporting staff, are not providing good quality of life. I think we can trust homes that have low turnover. I think that's a good sign. And I will tell you that that's sort of a thing that CMS has started. They've just recently been willing to report staffing turnover. You can go to Care Compare, and you can look up any home, and you can see what the turnover rate is in that home. And we can't recommend homes or not recommend homes when someone wants to know about putting their, having a loved one go somewhere and be able to have a good place for a loved one to live. Where would I want that to happen? But we can point them to a Care Compare, and we can say, that's probably one thing you might want to look at is staff turnover. Because if the staff are happy, they're usually better with the residents. So anyway, we have to say that our program would have to oppose any actions that would weaken training standards at any level, whether it be, we'd like to see more training for individuals with dementia. Individuals in nursing homes have much more complex needs than they ever have before. And more than half of them have some form of dementia. And we have very limited standards on what is required for dementia care. Really, really, really need to see that increase. Resident rights, one of them is to not be discharged without proper notice. And I have to speak to that. Far too many people are discharged with without any notice and unaware of their rights, even though federal requirements are that our office get a copy of the discharge notice. That's for nursing homes, the skilled nursing homes, federally licensed homes. We are to get a copy of the notice, and it has certain elements of information it has to have on it. We are pretty successful. Last year, I think it was 128 individuals. We're pretty successful in helping individuals with complaints, and that's where they gave us consent. We talked to hundreds more that we just gave them the information, they did their own advocacy. But 128 where we actually helped them with reviewing that discharge notice, talking to them about the elements that wouldn't be right, what could be put in place to meet that resident's need instead of discharging, things like that. So we're fairly successful in the skilled nursing homes. Where we have a little bit harder problem is in the assisted living, home plus, residential health care, where there is not a requirement to give us notice. There are very few regulators to be able to enforce if they didn't give notice. They're supposed to get a notice, the resident is. They just don't have to give it to us, so we can follow up and help them advocate, know to help them. And the fact that no one is really monitoring that is what we see is that people are just discharged. They aren't getting notice. They aren't getting that 30 days or to look at that was proper notice, and they're not following the steps. And so what happens is somebody is called in the afternoon and says, you pick up your mom, we're packing her stuff. Can you imagine? Can you just imagine for the person living there and or that family member? And they don't know they have the rights. So if we were given those notices, not that we need more work to do, believe me, but if we were given those notices, I think we would be more successful at probably getting some things stopped in that regard. And most of the time, it is about issues that if we could help them with coming up with a person-centered plan to address whatever the issue was, knowing that person and what need they're not meeting, that those plans can be put in place so that they are not, having an issue in the facility. Yeah. So that, and then the other piece of that is one of our tools that we use at a federal level to fight those involuntary discharges is the appeal availability. Now, I'm going to tell you, not that many people end up using the appeal. Not that many cases go that far. The fact that a facility may have to answer, did they actually follow the right steps to an appeals administrative court, makes them go back and look at, did they do that? And usually they go, well, maybe not. Maybe we do need to do this the right way. So it's a really good tool, even if it doesn't have to be utilized all that many times. It's very helpful. We would encourage appeals rights for state licensed facilities. We're just asking them to follow the rules that already exist or be able to appeal if they didn't think that happened. That's really all that's being asked there. Those are some of the high priority things. We talked about the visitation. I want to say in visitation, the other thing, we've had a lot of we call it guardian overreach. And the regulatory agency will tell you that that is not their role, is to look at whether guardians are restricting visitation or not. And our stance is this: it is very clear on the federally licensed homes that not only does it very clear that the resident has the choice of who their visitor is, but the facility has an obligation to support that right. So when a facility chooses to block one sister because the other sister is upset, or block somebody that was a neighbor for 30 years that mom has always seen, but a guardian has decided through the pandemic, no one was going in. And so now it's been easy to go, no, I don't want anybody to start seeing them again. That's not okay. That is a violation of the residents' rights. And it can be addressed somewhat, maybe through a court with the guardianship and things like that. We don't have that problem, by the way. I want to put a plug in for our Kansas guardianship program. We do not have that hardly ever with our Kansas guardianship program guardians, because they are well trained about what state law is and what overreach would be. And so maybe more training for guardians that are awarded through private guardianship would be helpful in that. But the facilities themselves, we believe, as a resident right violation, should be cited. And we're not successful in doing that yet, but I'm going to continue to advocate for that with Kdhe as well. But anyway, overall, what our goal is to look at a higher focus of these adult care homes agreed to go in that type of business, knowing what the rules of the business are. And ombudsmen simply are reminding them of what the resident writes, what those rules are, and then we will say, how can we? That's what we want to do. We will always work. We talked about I heard you talk about with the child care folks. We're a great entity because guess what? We don't cite anyone. Unless a resident really wants us to turn somebody into Kdhes or law enforcement or APS, we're just there to help solve the problem to the resident's satisfaction and within their rights. And that's all we're asking. We're asking for the facility or the home or whoever we're talking to, how can we support this resident in their right? And that's all we ask. We try and say, we're the fair warning system. We're not sure why you're upset with us. We're just asking you to follow the rules that you agreed to when you went into this business. But they do sometimes get upset with us about that. We're not always. We have some that work with us very well. I just want to say that too. We appreciate that. Anyway, if we would have a higher focus on resident rights and that core element, that person-centered care of right, the right to choice, the right to control our own lives that we all have. Quite frankly, we all signed that oath, that has our Bill of Rights and that, right to life, liberty, and pursuit of happiness. And it doesn't change just because our address is a nursing home or another adult care facility. So I signed that oath, and I take that very seriously, that I will make sure that I work hard, and our ombudsman will work hard for that, and that we will work to have that person-centered care. And there is not an acknowledgement or understanding really of what that means. I try to, in every place that I go and talk, I try to say that we still have nursing homes that are still, even on websites, putting pictures like, they put a hand like this, and then they have a bubble. And inside the bubble, they have a cute little silhouette of a man and a woman with a cane, and the man's got a cane, I think. One of them has a cane. And they have these people in a bubble. And then they have another hand over the top, and they tout that they're providing person-centered care. And I say that that is a really good depiction of residents telling us that they are prisoners wrapped in a bubble, prisoners within a bubble with power over them. Okay? So, the picture's probably right. I'm not sure the people that using the picture understand what person-centered care means. And that's what we want to try and help do, is because honestly, when people get it, when the staff get what person-centered care means, that we honor people's choice and autonomy and are treated with dignity and respect, everybody is happier. In the homes that do that, you walk in and you can feel the difference when you walk in the home. And there's life and community in those homes. And you can feel the opposite when you walk in another type of home, with this institutional, that still only looks at medical. It doesn't look at the reason that we want to live, those things that are important to us. So I'm done. I'm sorry I always do that. I can't help myself. I appreciate your letting me do that.
Well, thank you for being here. And Camille's on the Senior Care Task Force, and which working group?
I'm on 2 working groups. Actually, it was workforce issues and also protective services.
Okay, great.
Yeah, I appreciate that. Yeah, no, I really appreciate the work that you're doing and all of the work that you're doing in multiple areas, Madam Chair, for seniors. It's greatly appreciated.
Well, we appreciate what you do and being here and the advocacy that you do. I wanted to ask about your graph that you shared with us. It's not a graph. Chart that has the numbers of complaints. Okay. So how do you decide, like if it's a multiple, do you list it in multiple categories or?
So good point. So our category of complaints, our highest take, no, you could have more than one complaint within what we call a case. We could have one case that involved more than one type of complaint. So it is potentially, normally though, 1 or 2, because we honestly try and get the resident to focus on what is most important to you that we can try and address. It's pretty hard to address these complaints. We don't always get great cooperation. And so we usually do say, what's the most important, 1 or 2 things that we could work on today? So does that kind of answer your question? Okay.
So with the total of like 865, that's not 865 different people necessarily.
True.
Okay.
That's true.
And then, you discussed a little bit about the evictions, and, we have a bill that we've been discussing for over a year. But the category is admission, transfer, discharge, eviction. How much of that is eviction?
Actually, out of 152, 140 of those were eviction.
Really?
Yeah, and those were just the people that gave us consent. Far more individuals were part of probably the information and assistance numbers that you saw that, they didn't want it to be a complaint. They would take the information and they would decide what they were going to do or not do.
Okay. All right. Okay, committee, Representative Helmer.
Okay, everybody wake up. This is exciting. It's a weird question, but it's got to be asked. I have a friend who, she's learning disabled, and she is advanced stage. Her sister is in a care home. Her mother took care of the sister in the care home for years and years. The sister is very learning disabled, extremely. Probably, just really advanced. So she's in a care home. She didn't go into the care home till the mother died. My friend who is learning disabled is functional and still lives on the farm and is operating the farm and everything. But the sister has been made a ward of the court, or made a ward of the brother who is living in another state. The sister who is in the care home is very hard to deal with. So there's a man that's very hard to deal with. So the care home has put them in a room together, and and that controls their behaviors. And so my friend would like me to do something about it, and the care home says they're doing fine. They're taking care of themselves. It's not a skilled nursing home, so I haven't been able to do anything at this point, so.
Do you believe it is assisted living or residential health care, one of the adult care facilities? It's not a home provider, a group home for intellectually and developmentally disabled.
it's not.
So if someone can contact us, now I started in the beginning, I'll circle back around to that. If somebody contacts us, we absolutely will make a visit.
I can have her contact.
Yeah, and we absolutely will make a visit there. Now, having said that, it is not uncommon for us to get a call with someone that is in true concerns and their heart is in the right place, but to go out and find that the people are happy in where they're living. So I don't know. I'm just saying that, we'll find out if they can tell us. And even though people have, you said about being difficult. I can think if I can't get out of a place without ever telling a story, I'll try to do it quickly. But an individual who I was going into assisted living, because I was a regional ombudsman before I became a state ombudsman. Go into the home, and they have the person segregated off from everybody else who's dining. This woman did have an intellectual developmental disability. Didn't know her, but she was really the staff and her were not doing well with each other when I walked in. And I asked her name, and they told me, and I said, I'd like to visit with her. And they said, well, she can't visit with anybody without someone here. And I'm like, well, no, she has a right to have private visitation and certainly access to her ombudsman. So it's fine, you can go. And they're like, but she might, stab you with a fork, or I can't remember. I think actually that's what they said. I said, it'll be okay. And so I kind of sat across the table. Now, through a period of time in that visit, so I'll shorten this up. This woman was someone who said that was not verbal and had, just nothing. They didn't think she could communicate at all. But before I left, and I don't know what made me do it because I just didn't know how to communicate with her, but I told her who I was, and I happened to take a pen and I wrote my name and I turned it like that and I showed it to her and I said my name, and I don't know what I thought I was doing, to be honest with you. And she looked at my name and she took, I know, I took the pen and handed it to her. I said, do you want to do anything with the pen? Which I was kind of thinking it was not the brightest idea that I'd had because, you know, yeah, but she'd calm down, right? And so, because I'm giving her choice and control though, see? Okay, and so she takes the pen and she wrote her name, and I can't do it. I won't be able to do it. It was a 4-letter name, but she writes her name and she says each letter out loud as she writes it. Now that led to us discovering that before her parent died and she ended up in a nursing home, that she actually at some point had she had been in school and she had some services in the community, and so there was a lot of things. I mean, there's a whole bunch of stories about her that I really, kind of cherish now. But so what they had not done is they had not got to know the person, and they were not dealing with her in a person-centered way. So there I go again. Thank you for the story, but thank you for have them contact us. We'd love to visit and see if what we can ascertain from what the person wants or doesn't want. Yeah.
Thank you. She's just worried she's being used as a tool to calm the man down. But thank you very much.
And that may be, and
Thank you, Madam Chair.
Representative Penn.
Thank you, Madam Chair. Thank you so much for being here, Mrs. Russell. I appreciate your testimony. Quick question. I have about 4 care facilities in my district, and when we were campaigning and everything in the COVID era, you didn't have any access. So I'm very pleased that you're here, and I'd just like to get your thoughts about that since we have upcoming midterm elections and everything right now. When we talk about, I think you said that there's a right to choice, and we've all signed that oath, and it doesn't change with your zip code. I would imagine that our citizens who are inside of these care facilities, whatever their stage of development or age or disability or ability, that they still have that right to protect their political choice as well. I was not allowed in to engage any of my constituents out of the 4 care facilities that are in my district. I was just wondering, from your perspective in your office, is there anything that the state or the regional ombudsman's office would do to safeguard those political rights?
that is a resident right to be able to do that and to do that confidentially, and there's some rules around that. So yeah, I'm glad you brought that up. That is actually something I will say that was brought to us by one of the provider associations. Would we be willing to work with them to look at some ways to make sure that happened? And absolutely, I mean, that's a resident right, and that's absolutely something we would work with to help educate facilities on, what that should look like. Also, you mentioned, I encourage you all to visit a nursing home, and if you don't want to do it by yourself and you want to reach out to us and have a regional ombudsman go too, we would do that. I did provide some testimony in the Senior Care Task Force that resulted in a representative visiting one of the residents who provided a statement for that. And they first were a little bit taken aback that they had become, but then they became a little bit famous in their home for having done that. And it has created some change in that particular home, even in the views of the leadership in that home that did not believe they had some of the problems. I mean, I actually think they were serious that they didn't believe it, if that makes sense. And then the more they listened, the more they realized, well, we're only as good as our weakest link. It really only takes one issue to, be prevalent, that everybody else could be doing a good job. So anyway.
Representative Smith.
Thank you, Madam Chair. Ms. Russell, thank you. Thanks for your work. It surprised me a little bit where you were pretty positive on your employment and, being able to get the workers you need. And I've been a little bit afraid that we're not getting our workers. And like I said, I felt like you felt pretty good about it.
I feel like they're not out there. But what I'm saying is that some homes have been able to. And I think we need to look at what the conditions, what they're doing for those employees and the conditions how those employees are being treated in that home. As that being, because when we're contacted, they rarely complain about, and I don't, about their pay. It's not enough, so don't take that from me that I'm saying that. But it is more about the conditions they're working in, that there's not enough of them, that they don't know what they're supposed to be doing, and they're afraid they're going to hurt themselves, they get hurt. Those kinds of things. It's the workforce conditions that are really probably a bigger factor for us not having, and it's not always viewed. We're not always viewing this because, and I do it too. I come and I tell you these negative things that happen, and then they feel bad about what they're doing. And it's like, it's not the people trying to do the good job that need to feel bad. It's, but that is what happens. And we feel bad about that because we have excellent nurses and excellent CNAs and excellent, with just hearts that are out there working, and they're staying. They've worked those 2 8-hour shifts, or they've been there 16 hours, and they do have a problem with childcare at home, and there's stuff, somebody's not showing up, and they're staying again. And thank you for that, but they don't have enough people there to help them. And I will say, there is nothing that prevents these businesses from hiring people to do things that don't require the licensure piece. If many of them let people go that should have been cleaning or providing activities or doing all kinds of things that do not require the license. If they would have had more support staff in those areas instead of using their nurse staff or their nurse aid staff for those functions, they wouldn't have overworked those people. So that's sorry.
I agree with you. And I do hear where people are working double shifts, and it's very difficult. But I do appreciate what you're doing. And all the nursing home people, I think they're wonderful people, and they are underpaid. So thank you very much.
Thank you.
Thank you, Madam Chair.
Further questions? Okay, thanks for being here.
Thank you for having us.
We'll have you back.
Thank you.
Okay. Okay, committee, that's it for our agenda for today. We are not meeting. Oh, I was thinking about doing that. Oh, we're kind of out of time. I was thinking about working that bill we heard yesterday. I don't think it's that controversial. I think we can get through it. What's the number on that? I don't. Tell me. Okay, that would be House Bill 2582. That's the bill that we heard yesterday with Mr. Klump regarding, and then Secretary Howard was here regarding communication. Yeah, it was just yesterday. Anything that you have to, yeah, go ahead and just do it quick.
Thank you, Madam Chair. Good afternoon, committee. As you remember, the hearing yesterday on House Bill 2582 was related on information sharing between DCF and law enforcement agencies, in particular, a new subsection that directed DCF to give certain information regarding any of their reports or investigations to an investigating law enforcement agency, and then amended statutes in accordance with that.
Okay, thank you. Representative Esau.
Thank you, Madam Chair. I'd like to move passage of House Bill 2582.
Okay, it's been moved by Representative Esau and seconded by Representative Owsley to move out favorably. Is there discussion? Representative Johnson.
Yes, Madam Chair. Yesterday after the hearing, we heard from two of the proponents. They would like to suggest an amendment, which we have available, which is a very simple amendment and was in agreement with all parties. I believe you have that. Do I need to read that in, or do I make the motion to submit the amendment?
I have it, but I think it will be sent out electronically. It's not very long. Do you want to just read it?
Yes. Excuse me. On page 6, line 10 would be a simple addition to what is already there, which would add name and contact information of the reporter or persons alleging abuse or neglect, and case managers, investigators, or contracting agency employees assigned to or investigating such report. And it was a simple addition at the end of the sentence, and this was suggested both by law enforcement and was agreed to by the director or the secretary of DCF, and I would move this amendment.
It's been, did I hear someone? Oh, I got Moser on the second. Oh, is she seconding?
I'm online.
Okay. Gotcha. Okay. So it's been moved by Representative Johnson. I had Representative Moser on the second. So is there discussion on the amendment? Okay, seeing none, Representative Johnson, you can close on your amendment.
I move the amendment.
Okay, all in favor of the Johnson amendment, please say aye.
Aye.
Opposed, no? Okay, the bill is amended. Back on the bill, any discussion? Representative Moser.
Thank you, Madam Chair. I just had, can that amendment be emailed to us so I can throw it in that file in my computer?
Yes.
Okay, I'll check it. Thank you.
Okay. Okay, any discussion? Representative Esau, you may close on your motion.
Thank you, Madam Chair. I don't think I need to belabor the points, so I close. Unless you would like me to say more. Oh, I move that, sorry. Oh, I move that we pass House Bill 2582 as amended.
Okay. It's been moved to pass out House Bill 2582 as amended. All in favor say aye. Aye. Opposed, no? Okay. We even did it with time to spare. Okay, so we're not going to meet tomorrow, and we're not meeting Monday. And then next week, I do plan to, it won't be on the schedule, but I do plan to work Charlie's Law next week. So I'm going to have to look at it to, as far as which day, but you might, I know, I'm telling you ahead of time because it's been a long time since we had the hearing and then we had the discussion at the end of session. So you want to revisit that. So with that, we're adjourned.